I'll just let one of
We
them
got 2
try
more
it.
exams? 3?
And the
Go
final.
ahead and put that
2
on
more
for
and
me.
the final.
We taking the final. 'Cause that's how we felt
And
out
while
last
she
time.
puts that on, you have these, which are manual vibrations, basically. You have adult. We usually don't use it for adults because you can use these, and then but for babies they do like you to do the manual. And then, say you don't have these, you can just use one of the baby bag masks, and then
And then we also have
connect it to this real quick. It's gonna feel weird. You ever been on a roller coaster?
Yes.
Kind of like that.
But not with like the
I'm gonna go back next door. I got some work I gotta do.
feeling
I
of
gotta
the
go watch this
adrenaline.
No.
And then they have another one. I'm coming back over here, but that's all I do.
You ready? So you know how you're like going up and you feel like the track? That's kind of how it is.
cut it up.
Tanner, cut it up.
So it helps
Mobilize
break
secretion.
down and
Yeah,
mobilize
help you
secretions.
cough all your, it should be good.
Sometimes they're pretty thick that they need to be broken up with.
Yeah, you got
And some of the kids, so I did my rotation at Children's, and so we have the CF, the cystic fibrosis patients there. Some of the kids, it's on high, and they're sitting there eating,
Yeah,
like one
they'll
girl
be,
was
like, really high.
texting. It's really high, but they're used to the treatment, so they'll have it on the highest level because they have a lot of CF patients. Their secretions are really, really thick, so we'll give them their saline solution, and they'll be having that, and they have it on the highest level, and it's not even phasing them. Yeah, they're troopers.
Anybody else want to try?
I want to try.
You're like, I want a massage.
Feels like a massage.
I know. It took my breath away. I was like, I can't breathe. Take it off.
And then we do have this one. This is basically the same thing as these. It's just you don't have to sit there for, and you just turn it on. It's like a massage gun. Same thing. Less tiring for you.
But you would place that.
You could do it in the front, or you could do either one.
Okay.
Usually we do it in the back just because, they have tubes or they have, if they have surgery, usually do it
And
in the
like my
back.
ladies.
Yeah.
Especially if you can, if they can sit up. If they can't, then usually just use the back. Or there's something called ITV, but we don't have that here.
Oh, I was like, yo.
But see, I won't pay for registration for ARC. I won't pay for the registration because that's.
Sorry, and what was that? What was that for again?
This?
The equipment he had already.
Oh, this one, it's the same
Same
thing. So
thing.
it's the vibrations. Overall, vibration therapy is going to help break down those secretions and mobilize them. So this is just like, sometimes you'll use this with kids as well. So with the babies, it's something like this, but like itty bitty bitty. It's like the head is like this small. And since typically with kids, you'll kind of want to do the treatments for 10 minutes, babies can't tolerate that. Like newborn babies can't tolerate that, so you'll do 30 seconds per lung. So you'll kind of go like this. And since they're babies,
You don't have to.
they have 3, like, you know how like the red lungs, we have 3 lobes, 2 lobes, you can go all at once because they're so tiny, it's so condensed. And then 30 seconds and then you're fine. You want to feel it?
And you
You
usually
can
do
do
it
it
for
to
10 minutes
anyone.
each patient.
You can go like on your back.
At the ones at the hospital, they'll have a timer on here, so don't walk out the room. But
Cut it up.
They get it how to do it.
You can do it front.
Because you use what's called. So
Would it be
they
like
have to
you said like
attach
It breaks it
feels
down.
weird.
Because it's good for the patients to cough. So I know a lot of times when they give people cough medicine, but like in our job, we want them to cough because you want to get the mucus up and get the infection. That's where the infection is. So it's good to mobilize secretions, to give them medicine, to give them things that are going to make them cough so that they can cough up the phlegm that they have in their lungs. Yes, sir.
There's medications for that too, but that
Oh
would
yeah,
interact with
absolutely.
other
Mucus,
drugs.
saline is usually what we'll use. So we'll give them Duoneb, which will be the albuterol, to stop the bronchospasm, so to open up the airway, and then the saline goes down and it'll break up the secretions. And then after that, especially for CF patients, we have them do what is called a huff cough. So they will have the vest on. They'll do their flutter treatments, and we literally like force yourself to cough. And so they'll do it, and it's so much back pressure from it, from the flutter, that it'll make them cough.
So let's say you use this on a baby, right?
Yeah.
Neonate,
So
yeah.
what will the motion be?
So typically you'll kind of cough, make sure you have a good seal, and then you just kind of go like this. And that's it. You don't want to go too hard. A lot of the babies, you'll put like a cover on top of them too, and go on top like that. I like gripping it like that. I have more grip with it than just holding it like this. 'Cause I feel like you don't really give it much pressure compared to like that. And before this, sometimes you do it with like your hands. You cup it, and it's the same. Here's the thing. Another thing we use is an acapella or a flutter. So this will also make you kind of cough. You're gonna blow. Hello. You're gonna blow into it. You'll feel vibrations in your cheek, to your neck, into the upper airways. So this will also help you cough. So a lot of these treatments, they're to help you cough. We also have a cough assist that stimulates coughing as well. But this is gonna be like if, like a flu or whatever, where you have like mucus, you feel it, but you can't cough it up. This will kind of help because again, there's back pressure, vibrations, and everything. So I'll pass this around. You'll put your filter on, and you'll just kind of blow. Wow, what happened here? And that kind of vibrates as well. If you still, do you still have your filter?
Yeah.
So it's this one, the smaller.
The smaller.
Yeah.
Like this? Oh no, wait.
It should be that one. Okay, try the other side.
Oh,
Okay.
this one.
There you go.
So just blow?
Yep. Blow. You should feel vibrations.
Yeah.
Yeah.
I mean, it's Herman doing it. I'm telling you, from Herman from top to bottom, they terrible, man. It ain't, no, it ain't they too heavy. It's just they terrible. No, they don't treat the people right.
He was trying to send me over
And what do you want to use this for again?
So it's like if you have like those mucus that you can't cough up. Like you
Okay.
feel it, but you can't cough up.
It's like we're stopping.
Yeah, kind of stuff.
This is all 10 minutes.
Yeah, so CPT usually will always be 10 minutes. That is just like an exercise, kind of like the IS, where you do it every so often. So with the IS, like let's say every hour, let's do it. We'll tell them like, okay, do this 5 times, do this 10 times, depending on the patient's demands and the needs.
You're
They don't
really
get paid no money.
into
And then
Yeah.
they don't get raises. What
Blowing.
TCH does is TCH kind of pays for you graduates. They pay you on the front end.
So
And
instead
you
of
get a little bit
inhaling,
more
you'll
on the front end.
exhale
So
kind
when
of.
it's time to get your raises, you know, and so that's why a lot of people don't do that. No, Big Top always got one. Big Top always got one.
The other way.
Big Top. Big Top always got one. You know? Yeah, Big Top always got one. Methodist too. I don't know why y'all gonna apply Big Top. Yeah, I was just saying. What tell y'all doing it? I don't. Maybe they don't apply because they get.
Feels weird.
But they do.
But yeah. Do you have any questions?
It ain't even.